Imagine performing surgery with the ability to remove delicate tissue layer by layer while preserving the vital structures nearby. That's exactly what the Cavitational Ultrasonic Surgical Aspirator, or Cusa, allows surgeons to do. This advanced surgical device uses low-frequency ultrasonic vibrations, typically between 23 and 36 kilohertz, to fragment soft tissue. Simultaneously, it irrigates the area and aspirates the fragmented tissue, helping keep the surgical field clear. The Cusa is widely used in surgeries where precise tissue removal is critical, especially when working near delicate structures. In neurosurgery, the Cusa is a vital tool for tumor debulking. It's commonly used for procedures involving gliomas, meningiomas, and metastatic brain tumors. The device allows surgeons to safely remove tumor tissue while sparing nearby neural structures. It's also valuable for spinal decompression procedures, where it precisely removes tissue or bone without damaging the spinal cord or nerve roots. For liver resections, the Cusa excels at selectively removing liver parenchyma while preserving blood vessels and bile ducts. This precision is particularly valuable when treating hepatocellular carcinoma or metastatic lesions. In ENT and skull-based surgeries, Cusa allows for precise removal of delicate tissue, such as cholesteatomas, while preserving the ossicles or other critical structures. It's also used for skull-based tumors, where sparing nerves and blood vessels is essential. For spinal procedures, the Cusa facilitates the removal of bone and soft tissue during decompression surgeries. It allows for safe resection of spinal tumors, such as schwannomas, without damaging nearby dura or nerve roots. In gynecology and urology, the device is used for fibroid removal and tumor debulking in cases of urological cancers, providing precision in delicate areas. While the Cusa is incredibly effective, it's not suitable for every situation. It's less effective on hard or calcified tissue, as it's designed for soft tissue fragmentation. Surgeons must be cautious when operating near highly vascularized areas, as the device can increase the risk of bleeding. Additionally, it should be avoided in cases of coagulopathy or bleeding disorders, as well as when dealing with infected or necrotic tissue, to prevent the spread of infection. So, why do surgeons rely on the Cusa in so many complex procedures? Here are some of its key advantages. Precision. It selectively targets soft tissue while sparing adjacent structures. Reduced blood loss. The simultaneous irrigation and aspiration helps minimize bleeding. Improved visibility. Continuous irrigation keeps the field clear of debris. Tissue selectivity. It spares fibrous or elastic tissues, making it ideal for procedures near delicate structures. However, the Cusa isn't without its limitations. It's less effective on fibrotic or dense tissues. Prolonged use can lead to thermal injury due to heat buildup. Using it effectively requires experience, as there is a learning curve to prevent unintended tissue damage. In the hands of skilled surgeons, the Cusa is a powerful tool for precise and controlled tissue removal. From neurosurgery to liver resections and spinal procedures, it helps preserve vital structures and improves patient outcomes. However, its effectiveness depends on proper use and understanding its limitations. With ongoing advancements in surgical technology, devices like the Cusa continue to push the boundaries of what's possible in modern medicine.